Other techniques for providing oral care. Some of the difficulties associated with providing care to residents with dementia stem from responsive behaviors. Remember that all behavior has meaning, and the resident is using behavior to communicate with others. These behaviors often arise when a resident is tired, does not feel comfortable, or does not understand what you are doing. Responsive behaviors include both physical and verbal resistance. For example, turning their head, clenching their teeth, pushing the care provider away, or verbalizing their resistance. Get out of my room, or get away from me. In these instances, it may take a little something extra to ensure the resident receives adequate oral care. We will now review some other techniques you may wish to consider when faced with additional challenges. These techniques should become part of your day-to-day approach to providing oral care to residents with dementia. Hand-over-hand technique. The hand-over-hand technique allows the resident to feel as if they are providing their own oral care. The care provider places their hand over the resident's hand and guides them through the brushing procedure. Chaining. Chaining goes a step beyond the hand-over-hand technique. When a care provider starts the oral care procedure and then the resident takes over and finishes the process, this is referred to as chaining. The care provider can place toothpaste on the toothbrush, place it in the resident's hand, and assist the resident to place the brush in their mouth and brush their teeth. Once the care provider feels the resident is in control of the procedure, they can let go of their hand and allow them to finish brushing on their own. Distraction method. The distraction method is used to distract the resident while oral care is being provided, especially if they are not happy about having it done. The care provider can sing, hum, talk, or gently touch the resident. If the resident is grabbing at things with their hands, give them a face cloth to hold in each hand to keep them busy while you perform their oral care. Bridging technique. Bridging is a variation of distracting. Bridging occurs when the resident is asked to hold the same object as the care provider, such as a toothbrush, and then holds this object while oral care is being performed. Rescuing. This is when a care provider is experiencing difficulties with a resident, and a second care provider comes in and relieves them from the situation. The resident is told that the second care provider is there to help them out of the stressful situation. This may encourage the resident to like and trust the second care provider. The second care provider will then take over the oral care procedure from the first care provider. In situations where a second care provider is not available, you can excuse yourself, step out of the room, return a minute later, smile, and introduce yourself. The resident may not remember that you were already there and may be more receptive thinking you are someone else.